Hello, my dear friends. This is Dr. Muskaan this side, and the smile on my face is because I have discovered something new today, and I am here to share with you the same. So, I am going to share with you a case of HLH. You are saying, what is HLH? I was also thinking same only. It is hemophagocytosis lymphohistiocytosis. Now, what is you are thinking? Oh my God, this is so big name, and what is its meaning? This is basically a macrophage activation syndrome. First of all, let me take you to the journey of the patient who has dengue-like symptoms, but dengue test was negative. To my surprise, yes, it was treated on the line of the dengue and dengue test was negative, and S1 antigen IgM IgG was negative. She was 48-year-old female who has came with the chief complaints of pain in abdomen, fever with chills and vomiting. Now, when the investigation was done, the vitals were normal. GCS was 15 by 15. On examination, parallel was present. There was negative history of pain in abdomen. There was no bleeding manifestation, no melena, no cough, no loose stools. Further on, when the CBC was done, there was pancytopenia. Pancytopenia means there was TLC, RBC, and platelet level were low. Let me tell you the levels. Hemoglobin was 8.7 gram per dl, TLC was 2000, and platelets was 3000. Now further, there was, when POCUS was done, we found that there was cholelithiasis, there was thickened and edematous gallbladder, there was mild ascites, my dear friends, mild bilateral pleural effusion, mild amount of free fluid was seen in the perisplenic, perihepatic and pelvic region. These all findings are the complications which are seen in the patient of dengue, means dengue with warning signs, that is ascites, your pleural effusion, your fluid in the hepatic space, perisplenic, perihepatic space and the pelvic region. Further, my dear friends, the LFT was also deranged. AST, ALT, which is also recognized as SGOT, SGPT, was also increased, which makes the diagnosis of serum transaminitis. And alkaline phosphatase level was also increased. In kidney function test, serum creatinine was really high. So till now I have made the diagnosis of dengue fever based on the clinical features, and the second diagnosis is made from this patient is serum transaminitis. The third diagnosis which is made from this patient is pancytopenia. Now, when sir came and sir saw this patient during ICU rounds, he said this is HLH. I was thinking HLH, but why? What is HLH? So let me introduce to this term HLH. It is known as hemophagocytosis, lymphohistiocytosis. Don't get confused with the term. Just break the words and learn. Hemo means your blood picture, in which there is blood cells such as RBC, WBC and your platelets. Phagocytosis means someone has came and phagocytosed this erythrocyte, leukocytes. So in this there is phagocytosis of erythrocytes, leukocytes and platelets and their precursors in bone marrow and other tissues by macrophages. Now I will also explain you the pathophysiology, in which you will know the role of macrophage in this, because this is also known as macrophage activation syndrome. There is histocytic disorder, which is characterized by highly stimulated but ineffective immune response to antigens, which results in life-threatening cytokine storm and inflammatory reactions. In this, the clinical features which will be seen in this patient are: early features will be your fever, hepatomegaly, splenomegaly. Late features will be lymphadenopathy, your neurological symptoms such as neck stiffness, cranial nerve palsy, hypertonia, irritability, convulsions. There might be skin rashes, and it also includes multi-organ dysfunction sometimes, in which it includes lung, leptomeninges and bone marrow specifically. Now it is of two types, primary and secondary. And ये किस में होता है HLH? जिसमें कुछ इन्फेक्शन हो, malignancy हो, because of immunosuppressive agents, rheumatologic disorders, and there is mutation in this of FHL. FHL is familial hemophagocytosis lymphohistiocytosis gene. Now the primary HLH is in the patients who are less than 1 year of age. They does not fall in the diagnostic criteria. And secondary HLH is in the patient who is more than 1 year of age and they fall in the diagnostic criteria. Now, how you will diagnose that this patient falls in HLH? ठीक है, हमें फीचर्स दिख गए पेशेंट में, बट डायग्नोसिस बनाने के लिए वी नीड प्रूफ, है ना. सो द फर्स्ट, देयर इज इनिशियल क्राइटेरिया एंड देयर इज न्यूली डायग्नोस्ड क्राइटेरिया. The initial criteria is fever, splenomegaly, hepatomegaly, pancytopenia, your hypertriglyceridemia, there should be no evidence of malignancy, and your bone marrow picture. The newly diagnosed criteria states that there should be no NK cells, your ferritin level should be more than 500, and there should be soluble CD25 which should be more than 2400 micro per ml. Now, if it falls in this criteria, further you have to do management of this patient. So the management of this patient is on the line of etiposide, cyclosporine, methotrexate, and further there should be bone marrow transplant. So that's all about this case. I really enjoyed this case. Some findings which was easy for me to tell you, and some findings are not easy for me to tell you because मैं इस केस को सुबह स्टडी कर रही थी and देयर वर सम रिपोर्ट्स जो नहीं आई थी इस पेशेंट की, तो वो शाम तक आई थी जाकर, एंड आई शुड शेयर इट विद यू. वो रिपोर्ट्स कुछ नॉर्मल आई थी. लाइक आई वॉन्ट टू मेक द डायग्नोसिस ऑफ HLH कैसे भी बिकॉज आई हैव रेड दिस टॉपिक. ओके, सो ferritin levels were normal in the reports when it has arrived, and further when I have seen the reports, there was LDH level was also normal. It is good for the patient, of course, not good for the student who wants to learn the case. Okay, the urine output was also normal, and then iron, TIBC, transferrin, everything normal. Thyroid profile was abnormal. There was hypothyroidism which was appreciated in this patient, but overall it was a good learning because I have studied what all the features, what all cause, primary, secondary, what is HLH, what is diagnostic criteria, what is the management of this patient. So happy. But in future when I am going to see this patient, because अभी भी एडमिट है ICU में, है ना, तो I am going to share part 2 of it. Till then I am signing off. Bye bye.